I'm the chair of the Public Health Advisory Council for the town of Brookline. We're having a meeting tonight, our second in 2 nights, to continue to discuss the COVID-19 crisis and Brookline's response to it. I'd like to start by asking all the members of the council to introduce themselves.
David Hemingway from Harvard School of Public Health. I'm an expert on injury.
I'm Pat Marr. I'm a nurse practitioner on the Advisory Council.
Hi, this is Gretchen Stoddard on the Advisory Council. I work in global health.
Swanee Jett, Health Commissioner in Brookline, expertise in EPI and environmental health and public health.
All right. And I think Dr. Peter Moyer is on the call, but may not, you may not be able to hear him right now. But if he is, hopefully he'll have a chance.
Can you hear me now?
Yes, you can.
Good. Yes, I'm an emergency physician. Disaster management.
Okay. Okay. But before we start our formal agenda, I just wanted to express an apology to a citizen of Brookline, John Harris. He had sent an email, and that email was discussed. I think the intent that I had, and I believe the other members, was to be somewhat critical of the article, but not of Mr. Harris or his sending of it. It was a civic-minded thing to do, which we appreciate. This is not necessarily going to be something we're going to spend a huge amount of time on, but I did want to, again, express our apologies if it felt like we were attacking a citizen of our town. Dr. Jett, you asked to have a chance to speak.
Yeah, so, also I want to follow up with that because I think our conversation was spirited. It was the personal attack against the individual. You, as well as Dr. David Hemingway and myself, has done a considerable amount of research in our career field and published over time. And so, we look at research, and I had an opportunity to take a look at this, and, things that we look at is the research methods. Can the research be reproduced? Can the data be validated? And exactly what methods they used. I didn't get into specifics as to the data. I did go back and check, and the data that I use every day, everybody in the country can go to the WHO website, and they publish situational reports, and you can actually compare the data on the Worldometer site that they verify and compare it to what you actually see on the WHO website, and you would see a difference in the data. So I think we don't want to get into a peer review because that's the academic rigor in terms of looking at the latest research. We do know that science is changing. What we find out on the ground will later be published in terms of what is changing. We do know what is happening in China, and we also know what is happening in Italy, what is happening on the ground. I think our focus should be on preventing mobility and mortality in Brookline, having a thorough mitigation plan, galvanize the people to take personal responsibility in this fight, to work together, not only in Brookline, but as a region, a state, and with our federal partners, to help people that are out of work, to help people that need childcare, to help the school system. We have kids right now that cannot learn because they're not in school. We're not virtual. We have 800 to 1,000 kids that need food, and the schools provide food for them and lunches. Kids also need laptops so they can do work, and they can work from home. Right now, our businesses are suffering because they are closed, which means workers might not be getting paid because everybody doesn't have paid leave. And when we think about that, we also need to keep in mind while we have this discussion tonight that people have lost their lives. We still have people in isolation. We still have people in quarantine in Brookline. Even in my own family in the past week, I've been notified my aunt has been in the hospital and she is isolated with pneumonia. So I think we need to be very careful in our discussions and show empathy and sympathy to people that need it. Keep that at the forefront as Brookline moves to try to mitigate the issues that we see on the ground. And I want to galvanize the community to support the health department and other town departments so that we give a helping hand to every citizen in this community and reduce mobility and death. And that is by having a good strategy here and with our regional partners and with the state. Thank you.
Our agenda, the first item listed is to review of emails from the select board and town administrator. Obviously, the people are very concerned and a lot of communication has come in. I have seen many of the emails, not all of them, and I do not have them in front of me. I do know that most of them expressed obviously concern and encouraged us as a town to do as much as possible. I think there was in general, the tone of them was suggesting that we do everything possible to increase social distancing, both in terms of requesting sort of the personal responsibility and individual commitments that was just spoken to, but also within the extent of the power of government and without compromising our values and principles that we consider mandatory efforts when appropriate. I do think it might be worth getting quick updates on the numbers in Brookline. The research that was shared, both the article that was debated, but also some of the more the public health-based research is showing that there's clearly going to be more cases and a peak sometime in the future. The concern of whether our healthcare system will be overwhelmed. It's really a question of when, by how much, and how much more infrastructure can be.
We keep losing you a little bit, Tony. I think you have low bandwidth.
We're making now can have. All right, we were losing you too. I'm sorry. I wasn't getting any signal that I wasn't being heard. Not sure there's much to repeat. I was really in some ways trying to quickly just speak to the first two agenda items, the emails and the research that we've had looked at, and then perhaps ask Dr. Jitt if you, I want to couch this in terms of, what really is driving what is going to happen is the regional, statewide, and national epidemic. The numbers in Brookline are important to us because there are people, there are residents, and there are specific things the health department needs to do to support those people and protect people around them. But again, what's going to happen in Brookline in the long run is going to be driven by the larger epidemic. Nevertheless, I think it might be helpful to get an update on what our numbers are in terms of people who are ill, who are in quarantine, just so we know what's changed in the last few days.
So what has changed from 24 hours is we have 10 people that are positive right now. That was 2 new as of today. 22 people in quarantine, and we released 7 as of today. No, we have 22 people quarantined, and we increased the number by 7 today. We had 15 yesterday. 11 people have been released from quarantine total, and then we also released 1 person from isolation today.
Right.
1 person has recovered.
Right. I presume there are also people who are, I know we no longer have a presumptive diagnosis definition, but there are presumably additional people who are sick and additional people who have been exposed or may have been exposed, we don't know, and a limited amount of testing that's available to us.
So that's correct. So if you look overall, what is happening is, just in case Italy did do uniform testing. And once they did, they saw an 80% increase in their cases almost overnight. So
Right.
once we begin to do uniform testing, once we begin to test everybody that has symptoms, our case count will go up. Right now, we do have people in the community that are undiagnosed because the testing wasn't readily available.
In terms of the number who are untested but are sick, and again, they could have the flu. There's still flu circulating, but do we have any idea what those numbers look like? And how many people? Not for Brooklyn, right? Okay, all right. And do we have any idea when the testing will be available in the numbers that we need it? I know that's not up to us, but
No, of course, I heard the president was mentioned the other day that they're going to make sure that they do more testing, make it more available. I also heard that there wasn't a lot of testing going on because they actually didn't want that their cases actually reported. So it might have been some suppression there. I don't know, but I do know that the state changed their guidelines. Well, CDC changed their guidelines in terms of isolation. Because you usually have to test people before you release them from isolation. But because there's a limited amount of tests, we are allowed to release people from isolation if they are healthy after a certain period of time. So that's a change in the protocol from CDC.
All right. And it's probably worth underscoring what you said, which is that when we start testing more widely, we're going to see a significant increase in numbers. Some of that will be an artifact of the testing. Some of it will be because we are presuming that the numbers are going to go up.
Yeah, and you can also anticipate right now, and what I'm seeing on the ground, and what I mean on the ground is in the community and as well. I believe the hospitals are starting to reach surge capacity because protocols was changed in terms of people that were quarantined but were asymptomatic. We can now use them in a hospital, and also first responders, they can return to work as long as they wear a mask and take the proper precautions. And also the military is starting to stand up. And I don't mean the overall military, I mean the National Guard and the medical units within the National Guard. So there has been a request from the hospital sector through the National Guard for assistance in Massachusetts and Rhode Island.
All right. Now, you have asked us to approve the mitigation plan. We shared that and went through it in some detail yesterday, but we did not vote on that because, again, it was an emergency meeting and we had not given notice. But I believe you've asked us to vote on that today.
Correct.
Devin, I don't know if it's possible to put that back up again. I don't think I gave you fair warning. But if we could take a minute, I don't think I can share it. So that's something we can get in front of us.
Yeah, just give me 1 minute. I don't have it preloaded.
That's it for me.
Tammy, Meg, Tony.
Yes, please speak up, Peter. Yeah.
I think that the idea of, am I echoing
Yes, a little bit.
a lot? I think that we should be clear on numbers of people gathering. I don't think there's anything magical about 10. That's mentioned in one place in the document, and in another place it says they shouldn't gather in crowds. I think 10's a lot, actually. So I would encourage discouraging that word. I think that's from Trump, his latest figure that he just pulled it out of the air.
Okay. So
I have it, and I'm gonna bring it up now.
Good.
Oh, she brought it up. Okay.
great. figure out a way to. Is there a way to make it a little bit larger? I don't know if, oh, I can do that on my own there. All right. So, Peter, if I understand you correctly, you're proposing, first of all, that there be a change in the, the problem is with share, get it together.
Well, I know where it is. I saw fifth bullet down in the first section, and I mentioned figure 10. And be legalistic about it. I think it's a big number, so I think we should just leave it as groups of people. It does make me wonder how we're going to enforce all this, if we are.
A quick question. Is this something that we are planning to then post publicly and make available on the website?
So it is a draft, it's a fluid document. Since we talked about it in a public forum, it will be posted.
Right.
Okay, thank you.
Right. So I'm having technical troubles. I can't get this formatting out of the way, so I can't read the document the places I'm trying to read it. So
there it is.
All right, thank you. So if we could go down to the individual table. So
Actually, do you mind if I make a comment? So this is adapted from the CDC Massachusetts Community Mitigation Plan. And I'm wondering if maybe we should note that at the top or make a reference back to the Massachusetts plan, just noting that this is.
So it's not
built upon.
Massachusetts plan. I adopted this from CDC plan, and I input some different tweaks in there for things that we could do on a local ground. So this is not a direct adaptation from CDC.
So I also
but we
have.
can use it as a reference.
Okay, so I mean, I'm looking at the CDC Massachusetts plan, and it's same formatting, similar bullet points,
Yeah.
and
I
I
didn't
think
look
it's helpful.
Yeah, I didn't look at Massachusetts plan. I don't have a copy of that.
Okay.
But I did have a copy of what CDC does, and I had a copy of what Seattle and New Rochelle did, which was what CDC had suggested in that document.
All right, but I do think that what I hear coming from Peter, and so Gretchen, I guess if as you see things in the Massachusetts document that are perhaps more assertive or more stringent, to perhaps put those forward for discussion. I'm going to agree with Peter that to the extent that we can be more assertive in ways that that are going to be useful in Brookline, I think we need to be at this point. So perhaps if we were suggesting, Peter, with something along the lines of, instead of saying with 10 or more people, with any number of people who do not need to be in physical proximity with each other.
Yes.
I mean, again, this is how I'm behaving. Like, my wife asked me if we should invite my sister over, and I said no. She should stay in her place, and we're going to stay in ours. And I think that's the message we want to get out. I'm not sure. Is there someone who can scribe this? And Dr. Jett, as we're making suggestions, if you have any concerns about anything that we're saying, please let us know.
So you have to think about 10 or more people. So the state of Massachusetts has 25.
Mm-hmm.
You might have, and I think it's exempt now, you might have 10 people in the church. They might be physically spread out 6 feet apart, which that is social distancing. We often meet as a town administration, 10 or more people in the room, spread it out.
Yep, that's fair enough. But again, these are not mandates or laws. And we've talked about messaging. This could be read as, oh, if it's only 10 people, we can get together.
Well,
It
well, how
doesn't say
about
so
this?
long as, it doesn't say so long as they're all 6 feet apart from each other.
And I
How
think
about we use the language of 6 feet apart?
I think, sorry, excuse me.
Yeah.
I think one of the important clauses in that is individuals at risk of severe illness. So, I mean, I'm assuming that that refers to people with other medical issues or of elder over the age of 70. And I think for them especially, 10 is a lot of people. I mean, that's the way I'm reading that. Individuals at risk of severe illness should.
But it says individuals at risk of severe illness should stay at home.
Right.
Avoid gatherings
Right.
or any situations of potential exposure.
And I guess what we're asking, I mean, I guess
So in essence, what
we
I'm
haven't taken a vote, but again, a couple of us have said, why can't this be that we're recommending that it be social events with any number of people? Again,
Right.
the CDC said 10, but why can't we be more assertive here?
No, what I'm asking is, so I think that leaves it open for crowds greater than 10. So I think somehow we have to reduce the amount of people. If we leave it open and just say social distancing, it appears that it could be a crowd of 250. So I think we got to have the appropriate language that we need to get to a maximum number. Maybe that's the language. But that seems appropriate. Like you don't want any crowd greater than 10. You don't want no crowd. I didn't want a crowd of 25. That's what the state had.
But what if we don't want a crowd of 8? I'm
Then say you don't want a crowd of, you want no more than 2 people.
You can't say that for families.
Right.
I would say a maximum of 5 or something like that.
Well, I think right now everybody's adopting 25, 250, or 10.
Mm-hmm.
I think that's plausible, and that's a rational number. There are families of 10, especially as we do more quarantine. You might have a family of 10 at the park. So I don't want to put it to a tight situation where we have a fluid draft recommendation. Somebody says, they said 8 or 5.
Well,
The important thing to stress is that people, no matter where they gather, practice good social distancing and proper cough etiquette, et cetera. And if they sick, don't even attend.
Right.
Or if they're immune compromised, don't attend. And I think in this community, which this is referencing, most businesses have shut down. Churches have went to virtual. The only time I've heard of anybody gathering of any sort
right.
has been at the park. So you have to make it relevant to the situation that we're seeing now.
All right. Well, I mean, again, I think there was an idea expressed that there should be a way of saying that even 10 people might be more than ideal. I mean, obviously, a family of 10 is going to gather. They're not going to necessarily interpret living together as being a social event. Let's move on with the rest of the document. I mean, there might be a different opinion here about, how do is this aggressive enough, or again, are we looking for a little bit more? let's move on. Look at schools.
But let me just say one thing. Maybe the aggressive approach is to just say no gatherings. People shouldn't attend any type of gathering, period.
Right.
Outside of the house?
Outside of the house, unless you're going.
Yeah.
Only place I can see a person or people gathering, and I will hope they wouldn't gather, they're just going to get products.
Yeah.
It's Star Market, Stop and Shop, places such, Trader Joe's.
And that's not a social event.
That's not a social event, correct?
Right.
Oh, that's a good comment.
Should stay at home and avoid gatherings unless absolutely essential.
Yes.
Yes.
People are going to have to go to the supermarket. We can't ask them to stay home and starve. And if they go in and there's 10 people there, we could wish otherwise, but I think we're not in a place to stop that. So does that seem acceptable to people?
Yes, as long as it's clear of individuals at risk of severe illness, that those are people probably over 70 and people with other medical issues.
Right.
So we're going to leave the
We should
first.
clarify that in the
Well, we're
text.
going to leave the first part that's in that bullet point, and we would just say no social gatherings. You would leave. You would have individuals at risk of severe illness should stay at home, and nobody should attend any social gathering.
Well, yeah. Perhaps we could. There is a reason to have it be two because again, individuals at severe risk should stay at home. Somebody else in the household should be the one to do the essential shopping. So if it said individuals at risk of severe illness should stay at home and avoid all gatherings unless absolutely necessary, then we can have a statement about other individuals without such risk factors. And again, maybe here we want to add should also avoid all unnecessary social gatherings. Should adapt.
And that's sort of it's right underneath. That's after the individuals at risk of severe illness, other individuals without such risk factors
That's right.
should adapt to disruptions in routine activities by using remote participation.
If we were to leave the sentence in as is for other individuals, and then I just add another short sentence that says they should also avoid all unnecessary gatherings. I don't want it to read, if I don't have a risk factor, it's okay for me to go to a friend's house and for 7 of us to drink beers together. Beer is fine. It's part of why I'm in the review of the ER. I think people are aware that this is coming and this is serious, and they're looking for a little bit more intensive
Specificity.
Yeah. So I'm just trying to, I think later on we might want to push and ask the state to do more. But within this document, I guess what I do is put in language that is firmer in all cases where it's consistent with, not putting people in harm's way by preventing them from doing what they absolutely have to do.
Agree.
I think an additional bullet explaining what you had suggested is good. I agree.
I agree.
Dr. Jess, that work for you? You know what we said?
It works for me. Peter? Okay.
Yeah. We're advisory though still, so I just want
Yeah.
I like specificity because I see a lot of variation. Some people, for instance, would have relatives to their house, others would not. I think we should suggest it should be just that nuclear family in the house. No grandparents, no nothing else.
Peter, it's really hard to understand you. I don't know if there's anything you can do with the sound, or can you have headphones?
That's right. Anyway, I'm encouraging small household gatherings.
Yeah.
Peter, do you have something else in the house, in the home on? Do you have Are you reviewing this on another device?
No.
All right.
May I make one more suggestion for this section? On the third bullet, it says put household plan into action. In the CDC document, it includes a link to what that could be, and it might be helpful to have that link here as well.
I agree with that.
That'd be great.
Could I make a suggestion? And then the first bullet, it says monitor local information about COVID-19 in your community, and also have a link there or some way to do that, unless it's on the document in another place.
No, what I could do is put brooklinecovid19.com.
That'd be great.
That's our local link.
All right. All right. The next section, can we move to the next section? Schools, childcare, these are now, it says recommended closing. They are all, it's really mandated closing, is it not?
No, with the child care, there's exemptions.
Okay.
For first responders or people that we have a large population at work.
Okay.
Et cetera.
Understood.
I have a question about that. Will there be a daycare for first responders in Brookline?
So I just earlier today talked with staff, and we made sure that Bright Horizons reopened just for that specific need. But I'm sure there are other child care that's doing the same.
Yeah.
But a lot of child cares, have closed, and private schools as well.
Right. Yeah, I think given the situation we're in, changing this is probably not wise, particularly because, situations too where children are in danger, they need to be cared for.
But the reason I recommended closing, because if you notice among the population, even though the kids ill, but they are, once you close the schools and you close the child care home, care of the kids,
Yeah.
that makes them more susceptible, and you see high rates of death among the elderly. But I do want to make sure that people are aware that we are seeing cases of coronavirus in ages 20 to 69. So it's not just focused on the elderly, because there are people younger that are contracting COVID-19.
Okay. All right. So we leave schools to childcare as is. Assisted living and senior living facilities. We have that magic number 10, different context. Any thoughts on that?
But I imagine number 10 comes off the recommendation that I made to the select board on Monday, which is what they've passed.
So just cancel all gatherings, is that what it says?
So
Or-
it was specifically looking at, any gatherings, and you're talking about assisted living, period. So, usually if we have, say for instance, a norovirus outbreak, we would just stop any gatherings. It didn't make a difference of how many people were.
All right. So can we change that then?
Yeah, we can change that as well.
Cancel all gatherings?
Yeah.
Right.
Because there shouldn't be any gatherings.
Yeah.
And they should not have any new admissions,
Right.
and et cetera.
And do the assisted living facilities have enough personal protection?
That I don't
like
know.
masks?
That I don't know. I know that we are not supplying it because we don't have enough.
Right. Did you say that they've canceled admissions? All right.
That they can cancel any new admission.
Yeah, that's fair enough. Although just an unintended consequence is that desperately needed. Or most assisted living, I guess most assisted livings are probably from the community. Does this include nursing homes? Because those would be admissions mostly from hospitals.
Yeah, this is just looking at assisted living,
Okay.
senior living facility, and the daycare program.
So presumably those that are direct from hospitals would be rare enough that we wouldn't, it's not a place we want to cause a bottleneck.
Yeah, we don't need to cause a bottleneck.
Okay. Limit programs with external staff. External staff. I mean, there might be things I'm not thinking of that people need to do. So I want to be careful with
So
language.
it's stopping external staff from coming into a facility.
All right.
So
Yeah.
that limits the amount or the probability of transmission.
Right.
Can we say non-essential visitors or
Well, they might think
Staff?
somebody external might be essential.
So, yeah.
okay, I don't know if there are any external nurses that are required for care or something like that.
There are, there would
yeah.
be an assisted living, physical therapy,
Okay.
visiting
Yes,
nurses and that kind of, so.
We probably
it
can't
would
be more
essential
strict.
if they come in, yes.
Maybe adding essential or something to that nature.
Well, you did make a good reference. This did come from CDC mitigation plan. And this also is exactly the method they use with what happened in Seattle as well.
Right.
So this is preventing transmission in those places.
Right. Dr. I don't think we're questioning the idea. I think we're just looking for places where we could be, again, more assertive without creating unintended consequences.
I'd be leery of introducing people. I think the intent is, to eliminate as much as possible to eliminate people from the outside something that environment.
The way it's phrased, though, is okay. It says limits. Limit programs.
It says limit. We don't just get rid of it altogether.
Right.
Okay. Okay. All right. Any other comments on this section? I'm comfortable with it.
Gretchen, you look like you have some thoughts.
No, I'm okay with it.
I'm just reviewing multiple documents on my.
Okay. You see something better at the state? All right. I almost, again, my instinct is to be stricter if it's without, again, and willing to hear pushback if I'm being unreasonable. Requires staff to telework unless physical presence is necessary. I mean, so it obviously means they have to get the thing set up, but I don't think we're talking about a rapid and immediate enforcement mechanism. Is what we're telling people they should do.
I go back to your comment, Tony, about the nuclear family versus the extended family in the home, and that we should emphasize, if possible, should be just a nuclear family.
I didn't quite catch that.
Well,
Peter, you know what it is? You're in here. You're on my screen 4 times.
I know.
I think you might be in multiple meetings. And if you close out,
I keep falling off it. Maybe that's it.
Close out 2 more.
Yep.
You're still in 3 times. You get rid of 2. Just sign out.
Peter, could you write instead and chat instead of speaking?
Okay.
Although you're down to 2 and it's better. No, I'm sorry. There's still 3.
You get my comment? But it should be a family, not an extended family. No.
We're not getting it. Again, there's coming in 3 times at 3 different moments. So it's
Okay.
We're not able to see the comments, the chat.
I'm trying to.
all right.
Go ahead.
Peter, have you tried signing out of one once? Just go on the
Yeah.
screen as if you're quitting.
Yeah, I've been out.
Do that one more time.
Can you hear me?
I think we only got two left. You're down to two. It's better.
Well, here it is. I'm typing it in. I don't know if you can see the.
So why don't Peter, you sign out and sign back in? That's probably.
Peter, you need to make sure that you're chatting to everyone.
I did.
Yeah.
It's not too important. Go ahead.
Okay. So while we're waiting so that we can actually understand Peter, thoughts on again more strict language? Require staff to telework when possible, unless physical presence is required.
Mhm.
Would be okay with that language. It's definitely stronger.
I agree.
Right. Provide sick leave to anyone who is sick. Or do we leave it? People know what that means, but
You do know, yeah, that a lot of places employees don't get sick leave.
right.
So I think, Peter, have you signed out yet and signed back in?
Yes. Hey.
Yeah, so expand sick leave policies is just that companies to look at their sick leave policy and expand them to ensure they cover employees. And that probably will include part-time employees as well. So
Right. And I'm just looking at, expands might leave too much to, okay, I'll give people 3 days instead of 2, or I'll give it to my full-time, but not my part-time. And there is federal money that's presumably coming to bail out small businesses for this in particular. So could we, provide sick leave for every employee who is sick? Is that okay?
Sick from coronavirus?
do it because you.
Uh,
So I would probably COVID-19. Just the reason we.
So who is or may be
Correct.
okay.
The Massachusetts one says consider 7 COVID-19 symptoms, in case that's helpful.
Mhm.
I think
Yeah, so
19
7 days.
to say
Yeah.
symptoms. Sorry. I think it's important to say COVID-19 symptoms and not just COVID-19. Because you
Right.
don't want people waiting to get a diagnosis by testing or something and going in sick.
Right.
Right.
That's,
The reason
I like that state language then, except for the consider. Could it say
Well,
provide? So
I don't
provide,
like-
go ahead.
No, I was agree with you. I don't like sticking point for me 7 days.
Yeah,
The
we don't
reason
have to
being-
use their number. It's just
Yeah.
letting you know what they say.
One, we quarantine people for 14 days.
All right.
Be and then additional 7 or 10 days,
Right.
don't know how they feel to recover, and we've put ourselves in a 22 by that document.
Right. Well, in that case, then sick leave has to extend to quarantine well people.
And able to.
Um,
Which either way, it has to be approved by a local health official,
okay.
because that's how people are released from isolation or quarantine anyway.
What about provide sick leave for all employees with COVID-19 symptoms or quarantine? Does that cover everything?
I don't know, can you repeat that again?
So provide sick leave for all employees with COVID-19 symptoms or quarantine.
Or quarantine, how about or quarantine?
Okay. Although isolation applies to people with suffers that, but other people might not. Yes, we can include isolation. It's fine.
Yeah.
Okay.
The reason I said because isolation would be longer than.
Right. Okay. I'm else in this section that we need to look at. Wait, don't leave work yet. There was one thing I spotted. Can we get rid of the word large under eliminate large work-related gatherings?
Good idea.
So you just want to say, don't do gatherings? I mean,
Yeah, eliminate work-related gatherings.
Yeah, maybe cancel
No
work-related
workplace,
gatherings or meetings.
no workplace gathering.
Yep. All right. I think we're getting the hang of this. Yeah, everybody wordsmithing. I think,
Just for grammar, the third and the fourth and fifth, staggering and decreasing, and just put them together and just say decrease social contacts in the workplace, and then e.g. stagger work schedules,
Topic,
work gathering, or eliminate.
right.
I don't object to regular health checks on arrival day, but is that realistic? Does any non-health
Yeah,
you're doing? Oh,
right now we're doing it at our EOC and any entry into the EOC.
okay.
Are the Cs, do you know?
So I don't want to open up that Pandora's box, but on that, I'm also, while we're on this path in prevention, I noted in Italy that they had grocery stores open, gas stations, etc. The workers all had masks on. So, somebody mentioned, and, I'm sort of thought it was funny that we should close barbers and nail salons because there's close contact, but yet we allow takeout where the individual can be exposed, especially as we move into this atmosphere where it can be aerosolized.
Right.
So if we move into that atmosphere, that sphere, then we open it up that we might be exposing workers at the places that we have allowed to stay open to this virus.
Mm-hmm.
Has that been discussed at the state level yet, Swanee? There's a really interesting point, and at some point we're going to cross into territory where us doing it isn't going to, the state is doing.
The other issue is, so we already know that it's a shortage of masks, specifically N95 masks. put that in this policy, even though I think it's very prudent and plausible to think that this disease is aerosolized, that we should take that extra measure in terms of protecting the businesses, employees that stay open. And I don't think I think we should at least, if we're talking about being stringent on some of these other areas, we should at least document that that is the approach.
So you want to say when masks are available?
Yeah, I feel comfortable with that.
All right. Anyone not comfortable with that?
I think we have to say when available,
No.
because we can't take them away from the healthcare
Right.
workers at this
Right.
point.
So when available, employees should wear masks. In contact with the public should wear masks.
All employees? Yeah. That's right.
You know, the reason I firmly believe this is the direction we should go. In my career, as been a local health official, I have dealt with Ebola, SARS, MERS-CoV, and so, you know, every 4 or 5 years, I have dealt with an outbreak. I'm at my 25th year. So I think at some point we have to, there is no rationale at this juncture of dealing with epidemics and pandemic at this point that we don't have the supplies that is necessary to put it. So
I mean, you're right, but it's what is on the ground. Right. So when available, employees in contact with the public should wear masks. Anything else on this section?
Another point that is in the other Massachusetts document that I think is good is ensure that hand hygiene supplies are readily available in the building.
Right.
And I don't think this quite captures that. Any of these points quite capture that.
no, but it is something that, and we can put it in that for every workplace, but we have it in other documents, but we also include that it has to be 6% alcohol as well.
Okay.
That is on every to the public, but it can be included in this.
Yeah, that'd be great to add it. We done with workplace? Let's continue. We got that 10 people number in there again.
Mm-hmm.
So
It was 25. It's just
I know.
It was 25.
I just cancel gatherings. I'm Jewish, but I'll give up the minyan. Right, you're allowed to break law when it provides a mitzvah. Okay, other than that, any other changes there, concerns there?
The clause professional and college sporting events as well as,
Yeah,
does that mean to cancel any gatherings?
I guess it said cancel any gatherings, including professional and college sporting events, is probably what it should say, right? Those two.
Yes, that would be clear.
Okay. All right. Healthcare. We hope this is already up to date. Let's take a quick look.
Oh, I would just put in the document before the state and the recorder's office permit asymptomatic workers to work while wearing a mask. So now it's then, so we with that see a shortage.
Right. No, I understand now for that.
Yeah.
Tony, could you move it? So I like at one point it says restrict all visitors from facility and
I'm not in control of moving it. I think
oh, maybe not. Okay, you're moving it down.
it says restrict all visitors.
Okay, that's right. Yep,
Yeah. Exemptions for end of life.
that's right. Okay.
All right.
Tony, can you hear me?
Yes.
Good. Safety is really the first in healthcare often. They're not mentioned here.
What
And
would
I would like to see, appropriate PPE for fire, police, and the
Right.
and N95 and goggles. I think we should have standardization across the three services, and any patient, anytime there's a patient who has respiratory symptoms, there should be a mask as well as goggles.
So thank you, Peter, for that comment. Nevada Council knows that is already the standard practice in Brookline.
Is it?
Yeah.
My son's a firefighter, and I asked him, and so he says he doesn't see these things. So I would love to see, policies widely spread throughout the fire department, for that matter, across the services. I've asked cops to this happen. They don't know what they should wear. So,
check with Chief Sullivan, but I have briefed that to any call, the health department started this last weekend of people that are quarantined with the first responders. And we have tried to effectively each day, no later than 4 o'clock, the latest up-to-date information at the dispatch, so that when a call comes flagged, and they would know what type of PPE they need.
excellent.
That's already being done, but to include it in the document so people know that it's real.
Get it out under their our letterhead and fire police department. That's important, so it penetrates the department.
Suggestions.
Can't hear me. Can't hear me.
You
For a while.
can only understand you some of the time. What you're asking gets included.
I will.
I think he was mentioning something about logos of all different departments.
Yes. I want to get
this document is coming forth from the health department.
right. Without actually a joint document so that all the departments, public safety knows that it's coming from you and from their departments.
But the document is coming from, it was drafted by me, but it would go to the task force, which includes all departments, and the select board. So it's something, once mitigation plan, but it's all to the select board, and the town administrator put forth as recommendations how to mitigate.
Right.
So all departments are already reviewed it and have, and it's plausible, what's not. And so this is a joint effort now. Once everybody has the input and it's been properly vetted, hopefully that answers your question.
Another thing that just, so I think we might be done with this document. I don't have it wordsmithed in front of us, and we have enough sense of it that we could probably prove it if there's such a motion.
If we could just see the document again, sorry.
Yeah, I do think we should. I think
I lost the document, but there is may be subject to alternative standards of care and implement, if necessary, changes for example, allowing mildly symptomatic healthcare professionals to work while wearing a face mask. It just seems, I don't know. I don't know if that would be good practice. I don't know what other people think, but if somebody's mildly symptomatic, I don't know if a face mask
I agree.
would be.
Yeah. Oh, that one is tough. You're right.
It just doesn't seem like good practice to me.
No, it don't. But that's one of the steps that was taken in some other communities when they had a shortage of manpower. So we can't remove it, but
I don't think we're.
I thought the recommendation was that you should wear a face mask if you've been exposed to a patient, but not if you had a positive test.
so they put they put a face mask on before they allowed into a facility.
But I think a healthcare provider, if they had symptoms, shouldn't be worried.
But like I said, we reality. You have everybody in isolation, and you only have a few people that's available, which could be considered.
Yeah. Enough, but maybe what we can say is realities when they come, but we might not want to put in a document that we're approving of them.
Yeah. And please do remember, this is not a final document. So I just want to keep that in mind. What happens might be drastically different.
There, I do think it's pretty, at least for what we're anticipating only the next week, which is a long.
Yeah.
I would
So
vote to take it
perhaps
out.
what we can do, when we meet again, and actually have something written in, but perhaps we could vote, provisional approval of the mitigation plan with changes. Is that a motion we could hear?
Sorry, are we taking that out, that mildly symptomatic?
Yes.
I move to provisionally accept with the changes that we've made.
Second.
A second almost makes it a vote, but favor, please say aye.
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 All right. I also just want to point out that our mitigation plan could include things that would not be feasible, advisable, or even possible for a single small jurisdiction to do, but that we may want to ask the state to do. Dr. Jett, I don't know if off the top of your head you have things that you think the state should be doing that they're not doing, that you would love to have imposed on us, and it would have the kind of governmental support that would allow it to distancing. I know that some people down to those every down. I'm not sure we want to do that. There was a suggestion against to essentially close the town off to all traffic in and out. I'm not coming up off the top of my head. It might be good for the state to do now that it's not doing, but since we're gathered and we have a little bit of the chain.
Well, I have a few.
Please.
So one of them, just to think about, is to close, says they're not essential. So that is grocery and pharmacy. So I'm receiving a lot of pushback happen.
Mm-hmm.
Now,
Dr. Jett?
Yes, restaurants already closed.
Takeout. I'm sorry, to include takeout restaurants?
That would. And so I think some of those measures would create a lot of disruption. But when I say, close all business, that includes closing, people wanted childcare closed. People wanted barbers and nail salons closed. People want construction sites stopped. And so I think, if instead of each municipality trying to mitigate some of these efforts or requests, I think the guidance should suggestions from the state public works with that mitigation plan.
Yeah. The city of Boston did close down all construction sites, didn't it?
They did.
They did. But they didn't close other non-essential businesses.
Yeah, no. And so, that one people to consider in public health and in medicine, we decisions off of, and then we use professional judgment. And so these decisions, there has to be some basis for them as to why. And, currently now, as we talk about sites, we're talking about sites where it's outdoors, and there is no gathering. And there is impact as well by shutting these down. So, be mindful of social distancing. We often talk about all the time. I don't see how construction fits into this. I don't condom. I would have a problem with that. Having close contact with people in the building. It could be in a senior living facility, etc. And they're also maintaining takeout, because regardless, you still exposing somebody.
Yeah,
And
although
so
there's an argument about takeout is capable of preparing foods for themselves. Maybe.
Yeah, and the rationale, the reason I have a problem with it is because if the science holds true and is aerosolized and not in droplet form, should we be concerned about people that are with grocery stores? Should we be concerned with people at gas stations? So I think at some point we have to base our decisions off of rational process or evidence, and let the science dictate how we make these decisions. And I understand there is political pressure, there's different aspects and agendas, but we are a board of research is based off, and some of these political aspects maybe, and it has to be unilateral across, and to me that would be more prudent. So what? We close barbers here, they can go to Brighton. So
if I'm understanding you correctly, you're saying that you would be open if there were events to mandate closing, but you do not think it advisable to do that.
I think whatever happened as a regional approach or from the governor.
All right.
It's just like if you look at the end, it says that we would close off all, which is almost an outbreak work unless it was a regional approach. And we would have to work with Boston, Cambridge, et cetera, in order to that restaurants and for anything, all grocery stores, that would have to be applicable across board.
Right.
Instead of us doing a domino effect, because
I think that's fair enough. I guess my question then is, do you think, looking at the evidence that you've looked at, any evidence that would lead us to encourage the governor to close businesses that are currently open?
no.
All right.
No, I don't think. I think right now we're going to have more disruption.
All right.
But I think we have to have a balanced approach. What I am fearful of is one, I don't want to be an alarmist where we panic and have the community panicked and everybody empties the grocery store. So people might need something, they can't get it. Two, we just totally disrupt everybody's daily lives. And then we have mental health issues. So the same reasons I had concern for one senior living facility that had plastics for a certain period of time due to construction, and they were remediating asbestos. I was really concerned with confinement and people's mental health. So I'm concerned with people's mental health and being in a quarantine state with limited ability. I am concerned if we increase the amount of suicides, there are increased drug usage among youth. And so, because we did mitigation here, it had a an effect that we didn't intend.
Anyone else have questions or thoughts on businesses?
Is this recommendations, do we adopt or not?
I don't know.
Right. So with more social distancing, I just want to cover the waterfront here. So San Francisco, a lockdown order saying that everybody should stay inside all the time, absolutely essential. Never intended to enforce it. And the media had people walking along Embarcadero, presumably in effect. But statement, would message concerns, of severe social disruption. So again, it might, I think, be politically very, difficult to the point that it would backfire move for a single jurisdiction to do it. I personally wouldn't mind hearing the governor do it. I don't know if that personal preference on my recommendation from us, but I'll just put it out there for conversation.
Yeah. And so I would just say one more thing to that effect. 2015, 2016, I had the pleasure to serve as, which covers all the health departments in the nation. And so I have reached out to all the past presidents so that we can put some op-ed together, just as we did with Ebola. And I wrote a statement, did support funding for Ebola, but also support funding for local jurisdictions in case of emergency, because we never have the funding in a bill, always has to be passed by Congress. So, I'm asking the past presidents to put together a letter so that my friends like Dr. Gary Cox in Oklahoma, or my buddy, Claude Jacobs in Cambridge, or my friends in Seattle and New Rochelle, we each are dealing with different strategies. And what I really want to see is that these strategies are across the board from a national level, and that the state implement these strategies. We have this national and a approach, really talking about a national approach, because people are still traveling between the states in the New England to travel, they quarantine. So people are traveling from Connecticut, South Africa, and issues. But
yeah, I think that's true. I mean, NATCHO has a national voice that, like Brookline, we don't have a national.
Correct.
So is, I mean, you said that you're trying to come up with the uniform recommendations. Is that going to be one of them, or is it too early to know?
No, that's going to be without, and
Okay.
could have directed now in the past presidents. But I think the point is, I think we need to hit every avenue,
Yeah.
Not just local. We need to hit regional. But I think at the end of the day, if what we have seen from the data and from Italy, if
Yeah.
what we foresee is coming, push this to a national conversation, not just the state, but everybody has to get it.
I'll look for a sense of the group. We're advisory here. Sounds like you would be open. We want you to, again, encourage, participate with NATCHO, and also to say that parallel, that you make that recommendation to the state.
Yeah.
But from other, for this country, whether it's the local city or state or federal, to be telling people to lock down is a major statement. Are we all on board with that?
I think it would be helpful if there was any kind of data, public health data about, looking at the modeling with numbers, like if there's any triggering number. I think that's what happened in San Francisco. And I don't know, I mean, one of the problems with that is by the time you see the numbers behind,
Yeah.
they don't call it lockdown.
All right.
And I think, he said that people are pretty much following it. And I just feel like there must be, now that the testing is more online, people understand.
And it echoes Dr. Jen. Because the testing has been so, have data from the state, ecological, that the countries that have done it, Korea and Singapore, but and this is very, for me, that's enough right now.
Okay.
Because of the downside.
So she talked about data. One of the things that you can look at where it was documented, and once they begin to do aggressive testing, the numbers increase. Then they begin to make decisions what strategies they were going to use in order to the curve or reduce the curve. So I think we're behind the 8 ball in terms of numbers, but you can know every 3 to 4 research on Northeastern said. So what numbers you see today without any type of mitigation efforts, which we have begun to do, those numbers will continue to grow. And so, Brookline is no different. We've seen it growing. This state will continue to see it grow. It'll start now tested. Have an idea what the true number is. And then, at that point, you'll be more aggressive in strategy.
But at that point, it might be
To be too early than too late. I would
Correct.
say.
Yeah. Again, the downside of being too early is you annoy people, you inconvenience them. Sometimes in public health, when you are too aggressive, it does backfire because people, rebel against. There are anti-vaxxers in the problem with everything we're talking about. So the language requires sheltering in place. Recommend that through nature that through our health request be passed on to the state. But I think everyone should. I have to. People support that.
Shelter in place.
Looking for government mandate. We're not talking about how it would, or even if the state would instruct residents of Massachusetts to stay in their houses unless leaving was absolutely, that would do.
So Brookline itself is not residents.
Isolation from the state.
Are you asking us to on it?
Yes, please.
Okay.
But I think you have to define shelter in place. Can you go out of the house? Is it a single person? For pharmacies, supermarkets?
I think you're right. You're right. I think the notion is that it's anybody, even if they're living alone, essential. And I think and grocery stores have to stay open. That people need to go to those places.
And in San Francisco, you can walk your dog.
Well, yeah, I think you probably don't want your dog
Take it out to walk their dogs. Yeah.
Exercise, jogging.
I think so.
Yeah, I hope they're allowed to walk their children or take a.
Right. Because the psychological part of being caught in their house for several weeks is onerous.
Mm-hmm.
Yeah.
And then we also want compliance.
All right. So
Yes,
to leave it as it is, right? Because we've already, in our own mitigation plan, have encouraged people to, not to gather, not to go out. So I think I'm not hearing a sentiment.
Could we say something like that to seriously consider the idea of shelter in place? Just start talking.
Have to consider it in the future.
Put this out there. The entire nation going to a quarantine. So that's already being discussed levels. So I don't think it hurt, not that I'm trying to persuade a decision, but I don't think it hurts the ideology forward.
I bet you.
You would what?
And I think something I tried to say before, a family gathering, it's a common problem, it has been in my family as well, should be your nuclear family, not the extended family. No grandparents or grandchildren. I think it's worth saying being specific about a nuclear family versus extended.
Richard, your thoughts on the subject? You look like you.
Yeah, I was looking to as well, thinking about New York City's around shelter in place. I told residents to prepare for an impending shelter in place. And so I know for some of the younger folks, shelter in place also refers to things like this, and it can be really scary to think about what that means. So if we are going to, it's important to also clarify what that might mean.
Good point.
Yeah, that's a good point. That was a good strategy in New York because people prepared to shelter in place, and some probably stayed in.
Yeah.
The message of marketing.
David, can I put you on the spot? You've been listening, so but keeping quiet.
I mean, I think if it's, and I think it just has to be sold in the right way, and I think it has to be sold in a way that makes it clear why it's done and all the reasonable exceptions from getting, nobody else is and walking your dog and whatever, and going to this. So because you certainly want the doctors not to shelter in place. You want a lot of truck drivers. I mean, you don't want the farmers to shelter in place. So it just has to be made clear, I think.
I'm sensing, so you have a sense of the group, right? There's not a complete uniformity of opinion, but there's some awareness that we have to be moving in this direction. We want this to happen at higher levels of government. There's an awareness that the most assertive social distancing mitigation strategies that are compatible with the kinds of necessary exceptions talked about are things that we're going to urge the higher levels of government to do and encourage our citizens to be prepared for. I think that captures the full sense of the group. That might be as far as we can take it.
Yeah, and think about doing it earlier rather than later.
Yeah.
What would early be considered as?
Well, that's the hard thing. It almost seems as if it's going to be too early or too late. That there's no either side. It's better to go too early, I think.
Yeah. Here's what I propose. So I think in the interest of time, I think we need to look at maybe the governor to weigh in and stay focused on what strategies we could get the governor to do here. On the back end, I just got an email from Claude of Cambridge. So we could work in terms of the back channels on a national level. But the things we do need the governor to weigh in on is shelter in place, or what businesses should stay open versus what businesses should close.
Yeah.
And that it should be unilateral across the state instead of maybe a regional approach.
But I would say that there should not be any debate about early or late at this point.
Right.
Too early is over.
Well, the interesting thing.
You're saying it's time.
Yeah.
Well, to be honest with you, Pat, I know we have apprehension. I have grave apprehension just because of the disruption to the life that people know of. But 2 weeks from now, I might turn gray overnight. And because we didn't move fast enough to shut things down. Yeah. And I'm getting more, I would say apprehensive, but I wouldn't say that. I'm becoming more paranoid by the non-energy exertion of policy.
Okay.
To really get a handle on what's coming, because I know and everybody else knows on this council that we have not peaked. Right. And so, not being an alarmist, our measures of public health have to come faster.
I agree. I mean, the irony of arguing about some of the sources that we're looking at is that writ large, the messages of the alarm data are not that far off. We are going to see an increase. We are going to have the peak is at a minimum going to challenge our capacity in the healthcare system, and so it's all maximized. So whatever the policy that could mitigate without, and again, there's always but that don't cause consequences should happen now. And if we have overreacted, back off in 2 or 3 weeks, be so lucky.
Weighing in and supporting, a proposal about shelter in place. I'm thinking about ICU beds. I'm thinking about hospital beds, and it could really become a crisis. Yeah.
So what are you suggesting procedure-wise?
Given that we're not making a recommendation out of Brookline, I think as a sense of group, I think anyone's group will reflect the conversation. And Dr. Judd, unless you disagree, I think you have a clear charge to you in Brookline and also the message to give to the state and federal partners to help us even be more assertive and more proactive in protecting the community.
Yeah, as note apprehension, we just approved an amended mitigation plan.
Mm-hmm.
That mitigation plan holds not a regional approach. So at the tail end of it, we had, these are the 250 cases. And so 250 cases is a lot for Brookline. But to me, we can't go any further with mitigation without support of the regional or support on a governmental level, because it's not just Brookline, it's everybody.
Yeah.
And I am clearly seeing now of a hospital surge. I'm notifying the group. Military, medical at the base have been put on alert to galvanize, and not just in New England. I'm part of a cohort of public health officers across the nation. We talk and share email. The military doesn't move to action or alert unless there is something pending. So that's an indication that there's something coming. And so I think the faster we get everybody on some type of mitigation, on putting some of these shelter in place quicker, we can stop an epidemic, not only in this state, but other places.
Mm-hmm.
And so that's why I want to bring the conversation up faster. And the numbers don't take into account mitigation plan. And remember, in last week, at each level, there was your mitigation modeling around the effectiveness of the mitigation and stopping the epidemic. And so some communities was based off of that evidence.
Right. Two other quick things at this point. Mel Kleckner had recommended we can have a town meeting, a town hall for a more open process sometime next week. I'm eager to do, if I could propose Tuesday night, if it involves me.
How about I put a draft together for next agenda of this letter? Me and you work on it.
Okay.
If you have time, and let's get something.
A stay home order, a shelter in place.
Yeah, I feel like we have this talk. This sounds familiar, like something off the movie Contagion.
Yeah. All right.
Yeah,
Where everybody chimes in on the podcast and tells me what they're doing, and how we can mitigate in this pandemic.
I think we've done good work tonight. I think we've tightened up our own internal plan. I think, for those residents in Brookline who are concerned and want us to be as aggressive as possible, I hope we've helped, and we can help in our messaging as we move forward, help people understand that we are supportive of that approach, and we're looking for that from our regional, state, and national partners, so that hopefully it makes your job of communicating what we're doing a little bit easier.
We had, I don't know if we have time, Devin, to update us.
Yeah, so we had not as many listeners tonight. That's just because of sort of the last minute, notice and moving kind of rapidly. But that opportunity to host similarly to how the select board did, and that we would have your 4 days notice. We could use a hashtag time to keep continuity Brookline COVID-19, and then get engaging on a couple different platforms if you felt comfortable, and depending on what the status of our situation is next week.
Yeah.
So we having difficulty, and I know the select board used town hall or the select board conference room, or whatever you want to call it. Is it feasible that we space out without 6 feet distancing? Like,
we could definitely discuss it. I think depend on who is comfortable, at this time. I will say that Big has expressed to me that it's easy if everyone is remote. So I think, we would just need to be sure that everyone had a nice, strong Wi-Fi connection. I could do tutorials. That's what really makes the sound clear, cuts out the background noise. But I think, we're emergency meeting of, something Monday, Tuesday, Wednesday of next week. We're going to be raring and ready to go as far as, keeping up with public comment and the pace of that.
okay, so did you mention headphones? So we could put headphones on, and that would make it better.
It would make a huge difference.
Peter, I got a solution for you. All right. Well, I have nothing else, Tony. I just want to say I appreciate everybody at the last minute. I appreciate the advice, this document. I do want to end my comment by saying, it's a good discussion. We talked a lot about evidence-based, talked a lot about protecting people in Brookline. Go to brooklinecove19.com for the latest information. Community want to reach us, email, which you could also send questions. My nurses, myself, and other people are responding to these questions as well. And we will get right back with you.
Thank you. Just I want to ask, none of us are infectious disease epidemiologists. For having a town hall, it would be nice to have somebody. I know we probably would prefer somebody from Brookline. I might be able to get somebody from outside, but I think it would be helpful. There are going to be questions we're going to ask, really of a technical nature, that are going to be being.
Yeah, and I'm going to bring one of the people that's been emailed, a statistical standpoint, the person that people want to talk about modeling, et cetera, and evidence-based research.
Okay, some ringers in to help the team.
Correct.
All right. Comments or closing remarks? Anyone want? Thank you all very much. This is see you all next week. Call the meeting.
Good night, everybody.
Good night. Thank you, everyone.
Thank you.
Sorry, thanks, Tony.
Thank you.
Thank you.